In this session, we will discuss fundamentals of healthcare delivery system in India. Okay. And here we will also define rationale of healthcare by government. Health is a state subject, and this has been spelled out very clearly in the Indian Constitution, Part 4, Directive Principles of State Policy. We have clauses 39, 40, 41, 42, 43, 45, 47. These clauses describe the role of the state government. And later on, what is the democratic decentralization? And we will be learning decentralization part of the Constitution. And we will be dealing with the progress from the ancient times of illness care to today's highly technological advanced healthcare. And this is how evolution of health system across the globe and India. To begin with, we will define what is a health system. It consists of all organization, people and action whose primary intent is to promote, restore or maintain health. Health system comprises of healthcare institutions added with medical and paramedicals, medical colleges having their own personnel and providing services. We have program managers at central level, state level and district level. We have health management information system. So all these four will constitute what is called a health system. According to WHO, we have what is called as framework for health system. We have got 6 building blocks. Okay. These are the one of the building blocks. One is about something which is called as governance. We have to have good information in the organization. We have financing area. We have service delivery by different personnel, various programs, various institutions. We have different type of human resources. We have medicine and technologies. And right in the center, we have people in the end. So these are the 6 building blocks. And we have a number of challenges in public health system. Since a long time, there was a confusion and conflict about challenges in public health because of continuously changing problems, priorities and different health systems. There, public demand is a challenge, public health delivery is a challenge, we have epidemiological transition as a challenge, and very recently new psychological issues. These are the 4 challenges in public health. And what is the public demand? A challenge of demand? Increasing public demand for services, accountability, responsibility to community, including dealing with consumer protection litigation, dealing with social inequalities, poverty, social insurance and human rights, and many more challenges under the public demand. We have in public health delivery shortage of qualified people, trained people, skilled human resources. We have the problems, challenges in accessibility of healthcare in rural areas. We have poor quality of service healthcare. And lastly, we have out-of-pocket expenditure is very high. And we have shortage of drugs also for primary health care. We have challenges in epidemiological transition. There are large number of emerging and re-emerging diseases. Rapid industrialization, environmental pollution, and health impact assessment. We have globalization and international health issues, coming up. And lastly, what are our challenges in new psychological issues? We have social pathology problems, substance abuse, violence, suicide, gender sensitive services, behavioral change, communication, culture specific challenges, and we have large number of achievements of public health care system in India. In the last 63 years, we have carried out large number of programs and services. The Planning Commission was set by Government of India in 51-52 and soon started working for formulating first 5-year plan. We have health committees, we have 5-year plans, we have health surveys, we established a 3-tier healthcare system, we introduced large number of national health programs, we have come out with policy prescriptions, we have come out with legislations, externally aided projects, eradication of smallpox, eradication of guinea worm, eradication of poliomyelitis, and we have recently launched universal health coverage. And India has turned out wonderful events all these years. And we have a large number of, as I told you, health committees, 14 health communities, and they have given large number of inputs. What did they recommend to government to improve health status of community? They recommended integration. They recommended social physician. They recommended to introduce mobile health units. They brought family planning. They introduced multi-purpose worker scheme. They introduced health workforce, different type of health workforce. These are all achievements. And we have what are called as organizational structures to manage these programs. As I told you, organization is very required. We have national level organization, we have state level organization, we have district level organization, we have taluk level organizations, and we have primary health center organization also to look after the restricted population. Okay. We have International Health Agency, we have WHO, UNICEF, NORAD, USAID, DFID, OPEC, European Commission, Bill Melinda Gates Foundation, GFATM, GAVI, and few more. What will they do for healthcare? They are very useful. Funding support for projects and programs. They provide technical assistance. They provide advocacy. They recommend for system strengthening. And they recommend health sector reforms also. These are all very advantage. And as a result, Alma-Ata Declaration and Primary Health Care is the conference which revolutionized primary health care, which was held in Alma-Ata, USSR from 16 to 12 September 78, jointly organized by WHO and UNICEF. Government got committed from all member countries to work towards achieving the goal of health for all by 2000 AD. What is that health for all? Attainment by all citizens of the world by 2000 AD, a level of health that will permit them to lead a socially and economically productive lives. It was resolved in the conference that primary health care is the key approach to achieve health for all by 2000. Accordingly, National Health Policy 1983 drafted 21 goals to be achieved by 2000 AD. These are public health systems, healthcare delivery in India. According to part 4, as I told you earlier, health is a state subject, meaning that health of the people will be the responsibility of the state government. In view of this, government has started healthcare institution both in rural and urban areas. We have allopathy 3-tier healthcare system in India. In allopathy, there is a primary health care, which is the Alma-Ata Declaration. We have sub-centers and primary health centers. We have secondary health care. We have community health centers and state level, district level hospitals. We have tertiary health care, medical college hospital, super specialty and defect hospital. These are allopathy institutions. We have health insurance systems also and other agencies, defense services, railways, employee state insurance, CGHS schemes, etc. We have got private healthcare system. We have medical colleges, corporate hospitals, nursing hospitals, and specialist clinics. We have got non-government organizations, PPP and public-private partnerships. We have Ayush. We have health planning in India. See, between 1951 up to 2002, we introduced 12 5-year plan according to Nehruvian planning. Then Niti Aayog plans started, which is called as Modi planning, and Modi planning abolished Planning Commission on 1st January 2015, and National Health Policy was drafted in 2017. Then in future, no more 5-year plans, end 12th 5-year plan. And one very important thing is we don't have non-plan budget. We have only plan budget, and that is the change in the National Health Policy 2017. And we have come out with what is called a 3-year action agenda, 2017 to 2015, and also Vision 2025. How we are going to develop planning and budgeting process. We have got health component, very important. We have one side which called as state sector plans. We have district sector plans, Jilla Panchayat plan. That is democratic decentralization. And we have also what is called as NHM component, program implementation plan. So on one side, we have to develop 2 designs of health component plan and also NHM component plan, state sector and district sector. So one very important skill we have to learn is how to plan a health program for our organizations. Program planning is deciding what needs to be done, who does, what, when, and where. The 2 elements, key elements in successful program planning are the program or project itself and the interest and involvement of group members. We have to analyze this situation. We have to identify what are the organization needs, what are the problems, purpose and goals. The third one, we have program objectives and what are the solutions required, and take stock of our resources in terms of money, material, technology, skill, time, and select the method. Plan the details, do it, evaluate it. So that's how the plan. And we have Millennium Development Goals between 2000 to 2015. We will examine what are our achievements and what are these 4 goals which had done excellent progress, and the other 6 progress insufficient to reach the goals. 10 goals on what is next after MDGs. We have got Sustainable Development Goals, SDGs. So we will examine that. And one more important thing under National Health Mission is communitization. We have Panchayat Raj institution, that is Zilla Panchayat, Taluk Panchayat, Gram Panchayat. We have Arogya Raksha Samitis. We have Village Health and Sanitation Committees. And we have ASHA also as a communitization. The daughter of India, daughter-in-law of India. I call it as daughter-in-law of India. And then finally, whatever we say, our services should be of quality, good quality nature. Health services rendered to the communities to be of right quality for their acceptance and satisfaction. Good quality service is also important for demand and performance improvement. How are our public health system health deliveries concerned to ensure quality? Four models of health systems financing, expenditure towards health in different countries, beverage type, Bismarck type, risk pooling, out of pocket expenditure. We are going to explain all these details very clearly to make you understand how health system financing has a role in our country. What does India fit in? Where does India fit in? Whether it is a beverage type, Bismarck type, risk pooling type, or out of pocket expenditure, we will be discussing. How do you grade different states in India? And earlier, we used to compare infant mortality rate, maternal mortality rate, human development index, etc. Now, very recently, a composite index has been developed. Then we will understand how is that Punjab state has progressed to reach second place in India, pushing Tamil Nadu to third place. Now, Kerala is first, Punjab is second, third is Tamil Nadu. Thank you very much.